We have to learn how to do science as a whole person. And the way that we have done science in the past, where we looked at specific organs or specific molecules or specific diseases, we need to be able to take a more holistic approach. And that means we need to bring together a number of different science perspectives in order to make sure that we are looking at the problem as a human being, as a person who needs help. And so that compels us to think about how we conduct our science differently. And one of those ways is to seriously look at how we can collect data that we can share with one another. The HEAL data ecosystem consists of massive amounts of data that are collected by lots and lots of studies. And the data is highly varied. It could be imaging data, it could be molecular information, it could be data about exposures, it could be data about the state of a person's health, could be interview data. And it's going to be placed in the HEAL data ecosystem, which consists of a number of repositories. And so in order to keep track of all of this data and make sure that we can make it usable in the longer term, we must add additional data to the collected data, which is called metadata. And that metadata has to explain how the data can be used in the future. We don't really understand pain well. We don't understand addiction well. And so what we're attempting to do here is to use the urgency of the challenge we're in, this incredible health challenge, in order to do better science. And by doing the better science, we ultimately really want to help and have an impact on those people who are suffering. And that may mean new pain methods of treatment. It may mean new ways of looking at how we take care of people who have an addictive disorder. It certainly means gathering lots of interesting data and using that data that's so meticulously collected by these wonderful PIs to understand how the entire complex human system works as far as addiction and pain. And so some of the challenges we have are in the fields of putting all of the great scientific minds together and figuring out collectively how to look at this problem in a more creative space, in a more creative way. HEAL is helping us focus in on key questions around making data fair, F-A-I-R, findable, accessible, interoperable, and reusable. And that effort will go a long way into making our scientific endeavors go much faster, because it will enable us to use the vast amounts of data that we've spent a considerable amount of money collecting in ways that are more creative and leads to new insights for people who are suffering.